Welcome to Preventive Care Grand Rounds, session number 21st. We are happy to have today Dr. CATHY OMS. Dr. CATHY is the director of the Physician Assistant Program in the School of Allied Health Professionals. We are very happy to have her because she also is a graduate of the Preventive Care doctoral program. She was one of my students and now she is one of my colleagues. So we are happy because she came back again. A few months ago she did a presentation about her research on pickleball. It was a very interesting topic. I was a member of her committee on that. And then Dr. Medina was her chair. And then, but today we are interested in hearing something else. She is responsible to organize a mission trip to Mexico with her students. So we want to hear more about that because this is a passion of us for quite a while to see how can we involve students in preventive care or the preventive care program somehow involving a mission trip. Maybe after this lecture we can structure something together with Dr. CATHY OMS. Who knows? Okay, thank you Dr. CATHY OMS for accepting this invitation, and let's start with a word of prayer. Heavenly Father, we thank you for your blessings. We ask you to be with our students, both in preventive care and physician assistants. We ask you to be now with this presentation, be with Dr. CATHY OMS, that you can share with us this inspiration to do mission trips. We thank you for this opportunity. We ask your presence in Jesus' name. Amen. Dr. CATHY OMS, the time is yours from now on. Thank you very much once more.
Thank you so much, Dr. Dos Santos, and welcome everybody. Thank you for joining us this afternoon. I'm so glad you guys are definitely very interested in doing more mission trips, and I think it definitely could be possible. So let me just start off. I've been, prior actually to my doctoral studies, I was a student at Loma for graduate school, went through the PA program. So historically, the PA program had been doing mission trips way back in the 2000s. So I graduated in 2007, and it's something that we've always incorporated in the program. And some years it occurs, and some other years it does not because of political unrest and things like that, especially in our neighboring countries like Mexico. So for actually a good 5 or 6 years, we were not allowed, or the university did not allow us to go to Mexico for our annual mission trip. However, they opened up the gates again in about 2016 or 2017. We did a scouting trip, and we do everything in conjunction with the Student International Mission Service. So I'm hoping that you're familiar with them because they have opportunities for you to do international mission trips, even local mission trips. So just that is our SIMS department headed by Dr. Drakenberg, or Ed Drakenberg, and he has a wonderful team that will absolutely take you to wherever you go. So and I know some of the more popular international mission trips always get taken, I think, by the hour when they open it up. So but it's quite, as a student, I felt that was, one of my callings, and really got involved with the Student International Mission Trip. So I encourage you guys to look it up and be involved. So we incorporated this trip on a yearly basis starting in 2017, as I said, once they opened up the borders of Mexico. As you all know, we did not go last year because of COVID. The university shut down our gates again, but then fortunately, we were able to go this summer, 2021. I do have a lot of pictures to show you, and I do have a quick video at the end as well. But But I just wanted to let you know we have a culture and community course, and that course I actually teach. And we have certain objectives that we must meet. So that course is actually our service learning course. It is one of the mandates of the university for a program to be under a service learning course. So with that, then we incorporated this mission trip. There are three components really that we look at when we go to these trips. We want to make sure to immerse our students culturally. So in preparation for that, they actually get, for our physician assistant students, we have a Spanish course that they actually take, and it's geared toward more medical Spanish. So then it can also help them as they get into the clinical world. With that said, the other component is community. So we love to do community service on these trips. So I will show you some of the pictures that what we've done for the community. And thirdly, medical service. So because we are medical providers, we definitely expose our students to seeing patients. And for the trip, it's only 2.5 days. So it's a very short trip, but we try to fit everything in. So let me share my screen, because let me just give you an idea about what we do. So really, we leave we leave on a Friday, usually morning, and this is 2019. The summer of 2019, when we took a group into Mexico for our mission trip. Let me just, there you go. So just to let you know that we do have a site. This is 45 minutes south of the border. And we have a beautiful facility that was just made for our Loma students to go into. So this is actually Silhouette, and it is ran through, or the person who runs this is actually an alumni of our department, Sarah Mayer, and she has a supervising physician that she works with. So basically, this is a beautiful facility. It has about 4 or 5 clinic rooms, and it has about 2 dental rooms. And it's beautiful. So these are some of our students. They have a lounge / this is where we eat, and this is actually where we do educational opportunities for the patients that come. So sometimes in our trips, we have a few people from, let's say, speech pathology. Sometimes we have nursing students that come with us. Sometimes we have even a nutritionist that come with us. And the goal is for them to be able to talk to the patients while they're waiting to be seen. So it's really an interdisciplinary trip. So we always welcome anybody that, as preventive care students, we would love for you to do presentations. And again, if you are bilingual, that is even so much better. Our students learn to present in Spanish, just like the basic necessities, like basic hygiene. Why do you need to brush your teeth? How to, ideas for exercise or good nutrition, and why sleep is important, or why we shouldn't have a lot of stress in our lives. So basic things like that, they definitely welcome as well. So this is just a group picture. Again, this is the front. It's called Silhouette Ministries. And I just, wanted to take this time to let you know, at this point, Sarah Mayer, who is in charge of this clinic, is actually back in the States at the moment. And just ask that you keep her family in your prayers, because her husband was diagnosed with a brain tumor. So he's been going through chemotherapy and has had surgeries actually. So right now we're not sending any students, or they can't take any mission trip students there, because right now they've slowed down a lot because of what is happening with Sarah's family. But hopefully we are in conversation to try to help the ministry going at Siloé by providing them some, work and see patients. So hopefully we'll be able to continue that. So just keep them in your prayers. This is Sarah in black right here. This is like their medication room. And these are some of the clinic rooms and some of our students, and a lot of our alumni help and come down with us to do the mission trip. This is Professor Millier, and he's one of our faculty. So those are some of the clinic pictures that we do. So that's one component. And the next is actually doing community service. So when we do mission trips down at Siloé, we stay at an orphanage down there, and it's actually ran by another organization, and they love to have us there. We sleep in bunk beds. They have cottages for us with like 10 or 12 bunk beds in them. And so we just bring our sleeping bag, and there are about 100 orphans that we get to interact with. And so it's very cool to see, and they've just been really, really awesome to have us there. So this is about maybe 2 miles down from the clinic. And that year that you see in this picture, we painted some of their existing classrooms and facilities within the orphanage. So this is our community service. So here are students kind of cleaning, and so that's in the clinic, cleaning and pretty much painting the sidewalks and things like that. So they had a lot of fun. And these are some of the orphan kids that are there. They love face paint. They love playing basketball with you, soccer with you, and just really interacting with you. So this is again pre-COVID times. This was 2019, so we were able to do that. But otherwise, the last time we actually went through the orphanage this summer, they weren't allowed to interact with tourists that come through yet. So they were definitely being very, very careful. But the kids are very lovable, and they're just great. We usually provide a pizza lunch or dinner for them, and we help serve them. So these are actually protected kids. So we can't take pictures of the kids. We can't like post anything on social media, just because they were taken from their home because of, not so good issues. So we're definitely very careful in posting anything. One of the things that we do there, as I said, culture. They Ensenada, or where that the Siloé is located, is very close to Rosarita Beach. So we take our students on a horse ride down the beach. It's definitely very fun to do. And then, so these are just some of the pictures. And then we have a bonfire and have a Vespers with them that night as well. So they love doing that. We do some hikes when we can as well. And so these are just some of the group pictures. One of the things that we like to take them to is a museum down at Ensenada, and this is a downtown Ensenada, and it's a really awesome museum, very beautiful, and it just highlights the history of Ensenada and all the progress that it has gone through these many years, like who occupied the land very early on, and they have a lot of very good historical content that our students get to listen to. So because Sarah and her family was not able to host us this summer, we had to look for another place to do our community or our experience or a Mexico trip. Luckily, we have another site, and this is what I'm going through. This other site is about 2 hours from the border. It's in a little town called Uruapan, and these are basically, again, very cultural component that we have. These are some of our PAs and hosts that hosted us there. So Uruapan, we stay at a lodge, but same thing, lots of bunk beds and very actually nice accommodations called Mount of Olives. There is a couple that run that place, and it's wonderful. It's almost kind of like it sits on top of a little hill, and it's like vineyards all the way around. Hopefully I'll have pictures. So in the Mount of Olives, they have this big room where we can prepare all our medical equipment and our gear before we see patients. This is where we eat, and also at the site, they have their own little orphanage and also protected kids. So they have about 25 or 30 kids that come that are staying there currently, ages 5 to I think like 20s. So we also host like dinner for them, so they love it, and then we get to interact with them. So that's the Mount of Olives. So this picture that you're seeing right now is actually the grocery store that they have. It's called Calimax. And what we are shopping for here is the field workers. So there are many field workers in Uruapan. They have a lot of cabbage, strawberry. They have a lot of, just a lot of vegetables that they grow. So these migrant workers are called field workers. They live on this side of the hill and like squatters and like just boxes. And sometimes, they just have something small over the roof of their heads. So one of our goals for this past mission trip was to actually provide them some food. So this is us gathering food, putting it in like a garbage bag, and then handing it out. So in the video later on, you will get to see that. And in the migrant workers, we have about 2 or 3 vans that come with us. And these are like unofficial clinic opportunities that we get to have. And basically,
Sorry.
Somebody have a question? Okay. So we were listening to the kids, doing some physical assessments just on the side of the road or where they live. So as we give them food, we also want to build this relationship with them that they can trust us, and even like, listening to their heart, looking for anything medical related issues that they may have.
Oh, yeah. Thank you.
So these are our students, or sorry, that's Calimax. So this is the field workers there. Most of the time, the men work in the fields and the women stay home with the children. This is us giving away diapers and then food. At the same time, we get to assess them, look at their ears, eyes, nose, throat, listen to their heart. And some of them are diabetic. So we get to do a lot of diabetic testing, a lot of diabetic foot testing as well. And so we do a lot of these medical services as we give them some food and establish relationships with them. So these are just some of my students listening to their heart. One of the things that we did also was gather clothes ahead of time to give out to them. So we had a lot of kids' clothes, we had a lot of women's clothes and men's clothes to give out. So as you can see, they're very excited in just getting everything. The second site that we do mission service at, and also medical service, this is Casa Esperanza. It's a women's shelter. And again, this shelter is actually when the women get abused, this is a place for them to stay for the women and their children. So it was nice to get to know the ladies who stay there. And so our students got to do a lot of health screenings here as well. I mean, they came in with a lot of, issues. At the same time, we assess the kids and the women at the women's shelter. They love painting our faces. They love just interacting with our students. So at that time as well, we had to do lice treatments on the kids because there were a lot of they needed some treatments. So we were able to do the lice treatments for the kids. All right, so again, our students love food. So we were able to, really bring them to taco stands, and then they love the churros. And yeah, so food definitely they love. So that's another cultural experience that we have. We always do worship, and it's student led. So we get to talk about our experiences and just share a lot of things and a lot of insight about the trip. This is a Mount of Olives again in Uruapan that we stayed at this past summer. So as you can see, it's very beautiful. And then the couple on the right-hand side of the screen, Dave, Daryl, and Maureen, they're the ones who actually are hosts for Mount of Olives. So it's been really wonderful for them to open up the lodge. And the people in front is there are Sims hosts as well. So this is Ed with the bald head and Marisol, and then Daryl and Obed. So they are a part of our Sims here at Loma Linda. Another cultural experience that we definitely take the students to is La Bufadora. It's about 30 minutes or 45 minutes away from Mount of Olives, and they just get to really bargain and practice their Spanish if they want to buy something. They have a lot of stores in Ensenada. And so this is the blowhole, La Bufadora, if anybody has been there before. So it's pretty cool. All right. So basically what I'm going to do now, and as you can see, just pictures again, I'm going to go ahead and show you the video. But before then, do you guys have any questions for me as far as the trip and logistics maybe? Or I feel like I know that the Sims team is looking for more interdisciplinary interactions. So I think they're opening up trips. They go to Mexico pretty often. I think they even went this month and next month, and they're always looking for interdisciplinary programs to be involved with them. So if you are ever, want to go and have a weekend, they will be happy to absolutely take anybody to have this experience. So what I'm going to do now.
I have a question.
Yes, absolutely. Go ahead.
Yeah, you said you guys, thank you for the presentation. It's actually interesting.
Yeah, absolutely.
You said you guys gave some treatment, some form of treatment. So I'm like, since it's another country, are you allowed to like treat someone over there? How did you do it?
Yeah, so basically, great question. So because we bring our own medications. So it's a little tricky because we actually have to hide it when we cross the border. But when you are in Mexico, these medications you can also purchase in any of their pharmacies. So you can easily purchase antibiotics there. You can easily purchase, any antifungals, any creams, any inhalers. Obviously, they love dollars. So for us, because we're contracted with our pharmacy at Loma Linda, we get it at a very cheap price. So then all we need to do is kind of sneak it in. So we do bring our own medication. So if somebody needs antihypertensive medication, if we have a lot of wound care, because a lot of them are diabetic, we bring all our wound care things. And our students are definitely well versed with that. One of the big things that we bring is a lot of multivitamins. And for the kids, for the women, we definitely educate them on a lot of these medications as well. So we treat just acute things too, like cold, cough, and earaches and things like that. So because we are able to do a lot of full assessments for them. So we bring all our equipment. Yeah.
Did you have a follow-up question? Did you have any collaborators from Mexico in the program, like medical people?
Yes, we do. So aside from the Silhouette Clinic, we have Mexican doctors as well that are there who At this point, like this past summer, Dr. Carla wasn't able to come with us because she's actually giving birth pretty soon in the next couple of weeks. So she was pregnant when we were there. So we do have Mexican doctors that collaborate with us. But again, as I can tell you, it's Mexico, so you can pretty much prescribe things that they can easily purchase in their own pharmacies. The hard thing about that is then follow up and then what we can do after. So for example, our diabetic patients, we have, I was talking about the field workers. Some of the blood sugar readings are like in their 500s and they are functioning at 500. This is like their norm. So we do a lot of education. They work in the fields for 10 to 12 hours straight every day. And sometimes they can only get a hold of Coke and not water, right? So that's all they drink all day. They have their coffee, they don't drink water, and then they drink Coke the rest of the time, you know? So it's like, you know, just really re-educating them about, you know, their blood sugars and stuff. And it's amazing. They're not having any other symptoms, you know, no dizziness, no visual disturbances, no GI complaints. It's just, you know, that they've been functioning at that high blood sugar readings for all these years. So it's you know, we've seen really, really interesting things when we go.
Okay.
Yeah, and the follow-up care, it's hard. So when you don't have money, obviously you can't be followed up. So sometimes they do rely on mission trips like this to get even just some medications. We have metformin on board that we bring, but again, they don't have any money to be followed up, or they don't have any means to check their blood sugars, you know? So it's a little bit harder but the main important thing when we go is a lot of education for these people, because there might not be follow-up groups that come. You know, I only take my students once a year. And the SIMS team is aware of that. So that's why they're looking for more opportunities to go at least every other month or once a quarter or something like that. So definitely, you know, a site that's great for our students to go and experience. Dr. O, you had a question.
Oh, yeah. I was just curious. You said that you didn't go last year, but on some of the pictures, I saw that people were wearing a mask. So, were there any reasons why they had to wear a mask?
Yeah, so this year we were still very careful. So we wore a mask pretty much the whole time when we were seeing the patients. Yeah.
Oh, so it was for this year. I thought
it was this
2019.
Year.
Okay, that
yeah,
makes
yeah. Sorry, the first few pictures were 2019, where we did the mission trip at Siloé, and then everything else with the mask was just this past summer. Yeah. So as a last thing, I wanted to show just the video so you can see kind of like where we were at, and this was this past summer. So we were with the field workers, we were at Mount of Olives, and also the orphanage that they had a Mount of Olives. So let me see here, and I hope you enjoy. Let me just pull that up. Okay. right, and that's it. That was our video this year. So again, if you have any questions, please feel free to reach out to me. And I'm hoping that you are inspired to give of yourself as well. It definitely is a life-changing experience. So I absolutely encourage you to reach out to our SIMS department. They have wonderful opportunities. And without them, I mean, you know, without their collaboration, we wouldn't be able to do this for our students. So we really, really thank them as well. We're going again. We already have dates in July this summer. We're going back-to-back weekends, and we're really excited for this opportunity. Thank you all for joining me today, and have a wonderful week. Anybody else have questions?
So
No? All right.
you guys use transportation is car? You guys drive there?
Yeah, so the SIMS department, the transportation, we usually go in 3 or 4 vans, like the 12-seater vans.
I see.
And we also have to sneak in these clothes. So when we have donated clothes, we had to put it in luggages to seem and act like there are clothes. They're very strict at the border. They have us all pull in one corner and kind of look through. So because we've been doing this so many years, we've kind of become expert in kind of hiding. The reason being is you can get taxed. And if they find something, usually you just pay them like $50 and they'll let you go. Anyways, so at one weekend we had to do that when they're like, well, you had to kind of put it, you know, in this documentation, but all in all, you pay a fee if they find out. So we're kind of sneaky in bringing it when we cross the border.
And this is completely voluntary. Students just volunteer to go down there.
A good question. So because it's a part of my course,
Right.
it is a requirement to some extent. Unfortunately, there were some students that were not comfortable in international travel this summer. So there were probably a handful, maybe 5 or 6 students that were not comfortable. So I had to come up with an alternative assignment for them to do while they were here. Yeah.
So it's part of a course, or they get credit for this trip? Oh, I see.
It's a part of our culture and community course, which is our service learning course for the program.
I see.
Yeah.
I see. Well, thank you for sharing the pictures. Those are just priceless.
Oh, you're very welcome. Very welcome. Well, thank you all again for joining me, and feel free to email me at any time as well. My last name is Ohms, and you can find me easy on Outlook. Thank you for again joining, and have a wonderful week. Anybody else have any other questions?
Your last name is a little bit more complicated than mine, so.
The short
one more question.
Yes.
Did you get worried about security?
Yeah, so when initially we did, when they shut Mexico from one of our, when the university shut Mexico about in 2009 through 2015, there were just, again, as I said in the beginning, very political, there's a lot of political unrest in Mexico. So that's the reason why we weren't able to go. We had to do a scouting trip just to make sure it is safe for our students to go. As long as you travel together as a group, usually we don't encounter anything. Just again, depending, now that they've seen our white vans, even the field workers, when they see those vans coming, they know that, you know, it's something, it's a group to help them. So we have not seen or felt like we were in any danger at this point, you know, for the past couple of years that we've been going. Yeah, there are a lot of military posts that we have to cross. So they, again, look at our vans, especially when you go further south in Uruapan, we have a military post that we have to cross. So, you know, back and forth. So they are now getting used to us too. But again, we've been doing this again for about 5 years. So
do you go to the same place every year then?
depends on our contact. So Siloé, only 45 minutes south of the borders, were not available to us because of Sarah's family. And then this is our second site that we go to, which is about 2 hours away from the border. So just depending. I mean, obviously it's nicer to go closer to the border, but again, it's whatever's available and what God opens up that year for us. Yeah.
Some years ago, my daughter, when she was still in high school, went to Mexico for a mission trip with a group of church people. But there are other parents who said, I will never send my kid to Mexico because it's dangerous, right? I mean, nothing happened, but safety is always a concern when you cross the border.
If again, you stay within the group, it's usually less. I mean, we've been in their, small communities ordering tacos and things like that. And we've even treated some of the homeless people that has come up to us during that time. I've brought my kids at that time in 2019, they were only 4 and 8. Wow. And they came with us, yeah, and a really good experience for them as they interacted with the orphanage kids, and also we're like, hey, learn Spanish while you're here in Mexico. So I didn't feel at all that they were in danger. It's pretty, again, you just have to be smart and not go off by yourself. Yeah. So always stay with the group. We're always traveling together, eating together. So yeah.
So students don't have to come up with any extra funds for this trip?
We actually pay for it. Our department, because it's part of the course, we actually pay for the students. Yeah. All you have to have is a valid passport though. So that is, the key. Whenever, I will tell them at the very beginning of class, which is usually January, you need to make sure that your passport is not expired because it takes at least right now 2 months to renew a passport. Yeah. So my son, I was planning to bring my kids this past summer. However, my son's passport needed renewal, and I renewed it as soon as we can, and I still didn't get it. So my kids didn't come this time around. But my husband did, because he's the one who did the video. So he does the videography throughout our trip on a yearly basis. So yeah, it was only me and him that were able to come this year. But yeah.
So it's mainly for your class and students who register for your class mainly, but you did mention earlier nursing or speech pathology, did you say? So
right.
It is open to other students, but mainly the students who registered for your course?
Absolutely. We open it up even to the community. So a lot of our alumni, as I mentioned, because they are full-fledged, providers, they're certified providers, they precept our students. So they are usually with a group of like 2 or 3 students as they assess a patient as they come through. Yeah, so this summer it's going to be more of a clinic setting, just like before, where we have about 5 or 6 provider rooms to see patients. Yeah, but they're always waiting, so it's always an opportunity to teach. That's why we bring in the public health aspect, a preventive care aspect into this, and then really just to interact with the patients as well. Yeah.
Wonderful. Thank you so much again.
You're welcome. Are there any other questions? All right. Okay, I don't want to take any more of your time because you probably need to get back to work or school. So it's great having everybody. Have a wonderful day, everyone.